So we talked about digitalisation of processes. So that's moving away from essentially you're meaning paper records and the transportation of paper from one department to the other. How's that affecting security of patient information as well?
It's a really good question because even though we talk about the spine, Epic and Cerner, we then come across what the NHS call mini spines. So these will be local databases created to support a particular operation, and then within that there'll be workarounds with ward clerks or nurses updating Excel spreadsheets or Word documents or Access databases, and for the senior management and the operation of a hospital, not seeing all the data in real time is causing real problems. A good example is patient discharge. We've worked with a number of trusts where you have huge back office teams managing, updating Excel records to provide a management report by the end of the morning or by the end of the day. But of course, we all know that information's out of date the moment it's captured. So being able to digitize and connect all these different silos of information and connect based on how the nurses and the clinicians really work. And that's the interesting thing that I found, especially with the way that we work with our no-code platform, because they are the stakeholders. They're the subject matter experts of understanding how it is to deliver the service either at the bedside, within a clinic, and for them to be able to very quickly create the requirements to create the app and be involved in that process is quite empowering for them. And that then starts to filter up because you'll then join in the sort of the Excel spreadsheets that they've created as a workaround now into a proper app that is now connected to the mini spine, which is now connected to the main spine, and suddenly the senior hierarchy can see real-time data which improves everything across an organisation, from how the transportation hub works, how the porters are deployed, even through to how the hospital's cleaned and the cleaning teams. Suddenly you can geolocate, you can put SLAs and KPIs into these apps that then can be reported on. And so you're starting to see this whole digitization, this digital transformation of how operations works. And that's really important for the health trust because there are a couple of measurements that determine their funding. One is HIMSS, which is an acronym, but it's a standard. At the top level is being HIMSS 7, and that's an aspiration for most trusts. So one of the measurements of that is how do you capture electronic data and how do you manage it? And so using no-code as a way of creating apps where you are now managing and being able to measure your data helps with their HIMSS stage and performance. And that's pretty key to how they then get the next round of funding.